Hello, my name is Danny Beck, and I will be talking about a coastal storms emergency response plan for New York City Health and Hospitals. New York City Health and Hospitals is the largest public healthcare system in the United States. They provide essential inpatient, outpatient, and home-based services to 1.4 million patients each year. The organization operates 11 acute care hospitals, 5 nursing homes, 6 diagnostic and treatment centers, and more than 70 community-based primary care sites. With a workforce of over 40,000 employees, New York City Health and Hospitals is committed to the well-being and health of all New Yorkers in offering affordable and exceptional healthcare services. New York City is a city surrounded by water that has approximately 520 miles of coastline. One of the biggest threats to New York City are coastal storms, which can cause severe floodings, power outages, and damages to the city's infrastructure. One of the most devastating coastal storms in the past was Hurricane Sandy, which occurred on October 12, 2012. As for New York City Health and Hospitals, Sandy costed the organization approximately $800 million. The response plan at that time was quite inadequate. Most notably, the evacuations had happened post-storm, which caused complications that could have been avoided if evacuations happened beforehand. This is the outline of the response plan. It consists of the preface, signature page, mission statement, statement of purpose, authorities, definitions, communications plan, both internal and external, mutual aid agreement, and the concept of operations. The top image represents New York City Health and Hospitals facilities and their evacuation zones. The central office is located at Water Street and is unfortunately in Evacuation Zone 1. Furthermore, the image on the bottom is a picture I took at New York City Health and Hospital Central Office of Emergency Management. They had an elaborate setup of multiple displays, microphones, phone lines, and etc. The concept of operations is divided into 4 phases. The first phase of the response plan is the alert and notification phase. Starting 120 hours before the landfall of the storm, the Central Office of Emergency Management will activate the Emergency Operations Center, also known as EOC. During this phase, the EOC will first alert all facilities in regard to the imminent storm. Announcements will be released through the Everbridge HICS notification system to all facilities. To prepare for the incoming storm, the central office will conduct an assessment of failure in the following critical areas: communications, resources and assets, safety and security, staff responsibilities, utilities management, and patient and clinical support activities. The second phase is mobilization and setup phase, which begins 96 hours prior to landfall. In order to avoid competition for transportation, it is critical to begin evacuation promptly. During this phase, evacuations will begin at determined facilities and patients will start to mobilize to designated facilities and special medical needs shelters, which are shelters capable of providing higher medical needs that a regular hurricane shelter cannot. The operations phase is focused on continuing operation of care in capable facilities and special medical needs shelters. At this time, hospital closures, mobilizations of patients, and evacuations should already be completed. Additionally, the central office will monitor and ensure reliable communication between all facilities and other partnered organizations. The last phase begins after 12 to 24 hours from landfall. The central office demobilization activities start which include assessing the criteria for reopening of facilities, order reopening and repatriation of patients, and oversee restoration of normal operations. The central office will conduct damage assessments at affected facilities in order to begin reconstruction activities. The demobilization phase is a critical moment for the central office to conduct an evaluation of the effectiveness of the response. The central office will assess all phases of the response, including both pre-event evacuation and post-event phase. This is a timeline of the concept of operations that highlights the activities that I have just mentioned. Just looking at it from a glance, you can see that a lot of the activities are designated before landfall of the storm. This slide highlights the threat I have chosen from my THERA table. One thing that I did not know previously was that New York City is at its highest risk of coastal storms from August through October. Next, we have the ICS chart for New York City Health and Hospitals. Since my response plan was focused on the central office and its responsibilities to coordinate with all facility locations, the boxes in orange were the most relevant positions to my plan. The community training that I've developed was focused on personal flood protection in New York City. Objectives of the training was to increase coastal storms preparedness and personal flood protection. The audience includes patients, patient family members, hospital staff, and community members of New York City. With this training, the audience will get to know evacuation zones, how to prepare an emergency contact list, prepare emergency preparedness kits, and how to plan a evacuation route. Additionally, the speakers for this training will give an overview on how patient tracking works during mobilization of the patients in the case of a coastal storm emergency. They will assure that patients will be closely monitored and tracked carefully during a large-scale emergency. To conclude my presentation, I'd like to go over some of the most important aspects of the response plan. One aspect is that the evacuations need to start early. The earlier the better. Since New York City is a very densely populated city, it is inevitable that transportation will be competitive and in high demand. Therefore, quicker actions would correlate to better results. Additionally, the role of EOC and the central office is critical for a large organization such as New York City Health and Hospitals. It is important that reliable communication offers a smooth and organized response to a coastal storm emergency. Also, it is important for the central office to conduct an evaluation of the current response plan. This is when we can look back and identify gaps that need to be improved on. Furthermore, there are still some aspects of the plan that are additionally needed. For example, there is a need for a careful plan to decide what to do for the facilities located in Evacuation Zone 1. If the government orders a mandatory evacuation, the response plan should have detailed contingency plans for the central office since they are in Evacuation Zone 1. Additionally, strategic planning is always needed for larger scaled storms. Just like how Hurricane Sandy caused many limitations to the response plan, there is a need for additional preparedness and to improve on resiliency overall. Thank you for listening to my presentation.